Hey, Cam followers. It is a Tuesday night, not a Thursday night, but we have an amazing Facebook Live planned for you tonight. And I know there are going to be many of you watching this because we are really, really, really lucky to have Kiki Hausler come and join us and talk to us about gait development in puppies. But before I let her steal the show, I just want to remind all of you Cam followers that Cam produces lots and lots of different resources that we really, really wish that you would tap into. This is Why Don't You Listen, which is an illustrated children's book, really trying to teach children and their families how to identify the signs of pain. So we do not have situations where children, family members, friends maybe get hurt because they've bumped into, landed, knocked over the dog that is in pain, and the dog therefore reacts and then gets accused of being aggressive. We don't want that. Having been a vet for over 20 years, I sadly have put many dogs to sleep where they've been labelled. And that was one of the reasons that we wrote this book, and one of our followers kindly illustrated it. It's available from the shop. My dream is that it goes around the world into primary schools so that we can avoid these situations. If you're interested, please go to the Cam shop. Please support us. All funds go back into keeping this resource going. Right, now to the star of the show. Kiki, please introduce yourself and let everybody know who you are, what you do, and why this is going to be amazing.
So my name is Kiki Hausler. I'm from Germany. I have been a vet rehabber for about 16 or 17 years. So I got into the field. I started off with agricultural biology because I did want to become a vet, but it somehow went a different way. And then I started getting into the rehab, basically because one of my dogs, and I know rehab for a long time because I was into sports, so I have knee injuries and things like that. So, and I've been running my clinic now for, I think it's 14, 15 years straight now, self-employed. And after working as a physio, I often bumped into, some of the vets. Well, yeah, you can do physio, but you really don't need that. You could do it, but and since I have a Ph.D. and I was like interested in proving what we're doing, I thought I have to get back into the research area and bumped into Matthew Allen at the University of Cambridge.
Mm-hmm.
And that's where we kind of joined forces in looking at some sort of measurement so we can get an objective way of looking at our resources, at our indications, and, look at some of the follow-ups.
Mm-hmm. Well, explain to people why this objectivity is important, especially with Helly's papers that have just come out with Anna. So there's a number of papers where they've done like systematic reviews on the information, the evidence available for all the different therapies that we use for chronic pain, musculoskeletal chronic pain management. And it's not pretty reading, is it? Because there isn't strong evidence base for a lot of the therapies, partly because we haven't tested them and we haven't had good objective ways of testing them. So this development in objectivity is much needed, and there will be a nice cascade of events that come from this that starts supporting our choices of what interventions are suitable for what conditions and when. So it's like a pivotal moment, isn't it? Having these objective ways of measuring improvement or deterioration.
Well, that's very true because, all of us pet owners want to help our pets, somehow. And sometimes you want it to work, but it might not work with, the specific dog you see in front of you. And to be honest, that was kind of like what happened to me. You get educated and you have your kind of path or routine, what you would do with a cruciate maybe, or, an elbow. And sometimes you would just be stuck with, the dog's not getting better, and you are kind of like, I was always thinking, well, I'm sticking to what I was told or what I was thought what we needed to do, but it wouldn't get better. And that's where I was like, oh, I need to find out what's going on. So we have 4 legs, and they can compensate, and sometimes you have a hidden indication which you might not get. It's kind of like you don't know how they shift properly. Sometimes they're very anxious when they get into the clinic because they've been through a lot of things, and then you might miss something. And the other thing is, well, we have to prove what we're doing, and looking at the not only the bones, looking at a still picture, like an X-ray or even an MRI. We don't have functional MRIs. Basically, we're looking at the dog sleeping most of the time. And that's, put that in a context with the dynamics, and you get a better picture of what's going on in dynamics. So I think that's getting an objective way of looking at the dog, not just walking, back and forth. That's what we still do, but we still have them on the treadmill to get the exact same speed, the exact same routine. Everything should be the same and standardized. And then we can look at it objectively.
So what Kiki's been doing for the last few years? How long has it been?
2016, that's where I started working with a treadmill.
So treadmill is used quite extensively by many therapists for a therapeutic reason. However, Kiki's been working on a treadmill that is not only therapeutic in what it can offer, but also potentially can be diagnostic as well. So not only are you using it to exercise the dog in a certain way to develop certain areas, but you're also being able to monitor whether what you're doing is having a beneficial effect. So this is quite groundbreaking. It's stupidly exciting. And what I love is it's potentially affordable too, whereas many of these tools are out of people's prices range. So this is where Kiki has her understanding about gait, and this is why tonight's going to be interesting talking about gait development, which is what I'm sure many of you are wanting to hear about. So we've got a little bit of a plan, partly because I ask too many questions and I tangent and take people down rabbit holes. So I'm trying to behave myself today. But first of all, what we're going to do is go right back to basics for people that go, I don't know what you mean by gait. And then we'll proceed from there. So what do we mean by gait?
So there are a lot of different gait patterns we can look at, or gait, walking. You can look at a dog walking. You can look at the dog trotting. You can look at the dog ambling. You can look at it in gallop. So that's what we started doing. But basically, we cannot really, walking, even sometimes if you look at the dog walking, you can't really tell, well, is it lame on that leg or lame on that leg? Is it compensating to this side? So having them move and looking at their gait is very, very important to tell you what is going on in the body. So we do have some stance analyzing, but looking at dynamics makes the picture whole. That's what I would say.
Definitely. And then my experience with stance analyzers, having been a vet for 20 years, there's been times that dogs have walked in, I'm like, I can't see nothing. I can't see nothing. And then you put them on the stance, you're like, oh, holy moly. And they're offloading a hind limb or bilateral hind limbs. And you're like, I just didn't see that visually, but here I can see. So having a dog having the complexity of also walking or trotting, or as you say, galloping, you're going to collect way more data. So tell us a bit about different gaits, because many owners that are watching have never really thought about gaits. Obviously in the simple terms, walking is slow, trotting is slightly faster, and gallop is even faster than that. But these gaits have developed for efficiency, etc., haven't they? So they all have different attributes that make them useful. Can you kind of go into a little bit more detail about why they've developed?
Well, thinking about your dog walking around and basically walking will be investigating the environment. So they don't really want to cover a certain distance with walking. So that's probably the part where people and dogs do not really fit together. So walking slowly, that's what a dog will probably not choose to, cover a certain distance. But if they, checking out and checking who was there before I peed on that pole or whatever, that's where they kind of like investigate. So that's what walking basically is for in dogs. And a lot of dogs that have developed, a certain pattern or certain pain in their body will start to move slower because they cannot maintain the speed that they're used to, or they try to, just run away from it. So I think if you think about a proper walk, and sometimes when you think about maybe crafts, you look at them being in a show ring, you will see them walking and you will see them trotting. And a lot of breeds that are supposed to, maybe like a whippet or a greyhound, they're supposed to gallop, for what they're being bred for. You never see them gallop in the ring.
No, that's true. That's true.
So, I mean, sometimes thinking about what your breed was bred for, if you have a hunting dog, it's supposed to be fast and, turns. And I think sometimes when we think about breeding and their use, that's where you have to think, well, is walking and trotting in a ring, does it represent the ability this dog has to show within its body? So looking at posture, according to their way they're supposed to move in a healthy way, I think that we need a little bit of a mind change there as well.
Yeah, definitely. So if you were an owner that's now going, oh yeah, I've never really thought about it. So my dog, walking and trotting and I should make more of it. I should read more into it. I should observe more. Is there a specific gait where you're more likely to see lameness? Is there a gait which is going to be better for, say, muscle building? Is there a gait that's going to improve agility? Could you ever go into that kind of mindset? I just want owners to think differently rather than just putting the lead on and going. I want them to realize that there is such a variability in what their dog can do, and to harness it, not only in objective monitoring, but also in keeping their brains active, keeping their bodies functional. And I've found when I'm talking to owners, when you start saying, but you could do different things on the walk, they're like, can I? They just do their own thing. And you're like, no, harness it. So try and give people a few bits and bobs of what different gaits can do.
Well, that's really a good suggestion for owners. And sometimes if you put a collar on and you change to a harness, you have different patterns and different pull and push on the dog. If they pull on the lead a lot, then what I think you are supposed to look at your dog is if you look down at the dog and it's pulling on the lead, maybe pulling on a collar differently than on a harness, that's something. I mean, I would look at the spine, because most of the times we look down at the dog and you cannot really see how their joints move, because you cannot go from the side and walk on a straight line next to them and go like, oh, that's how the joint moves. So most of the times you will see the dog from behind and from on top. So I would look for the spine and spinal movements. So we have cameras over the treadmill, which we look from on top.
Yeah.
What's also very interesting is if you look on top, you look down on the dog, you will see, is my dog properly shaped? Do I have a silhouette of a dog? Or is there, something, is it a bit chubby as well? And the other thing might be, how does their connective tissue move? So, sometimes you can see that it's moving from side to side. So I have a Labrador and she's pretty lean, but her connective tissue is just awful. You can just push and pull and it just moves anyway.
Yeah.
When she moved in, so she has bad hips. When she moved in, everything was just moving. There was no stability in this dog. So she's still misflexible. So she's like all over the place. But now she does have a little bit more core stability. So that is something, if you get, some exercises, that's where you want to check for how much movement is in the dog. Because this movement also pulls on the spine. I mean, if you have that connective tissue and it just wobbles around, it could be fat, yes, that pulls from side to side. So there's a lot to investigate just having them walk with you. And the bad thing about us not being able to look at dogs moving fast and then telling, well, is this dog lame or not? Because they can compensate with 4 limbs a lot better than we can. I mean, so that's where you as an owner want to look at your dog walking.
Yeah.
Walking in a proper line towards, maybe ask somebody else, walk towards you, away from you. You can stand on the side and maybe tell, is there something going wrong? And I think that's so, so good for us as physios and also the vets. You see your dog as an owner, most of the time. We only see the dog when it comes into the clinic for a short amount of time. So we need to know what the owner sees on walks, how it lies down, how it gets up, when they're, comfortable in their environment and maybe not scared. So I always ask the owners to take videos, that we can look at the videos, what they mean, and take the videos from a good angle.
Oh, yeah, that's quite a funny one. Amount of videos that suddenly look at the sky and look at the grass. Absolutely.
Yeah. Or they're far away and you're like, what? Don't know.
Yeah. So we've had a couple of amazing owners over the years that are really good at monitoring their dogs. I think they've been through bad experiences with a previous dog and they're absolutely adamant that they're going to pick up on any signs of ill health early. And they're really inspiring. So I've had one owner that takes a photo of their dog a couple of times a year in exactly the same location and exactly the same posture. And she can keep an eye on body weight, coat pattern changes, posture changes, tail position, neck position. And it just means that she's permanently cross-comparing to the healthy self. And I've had people that have done videos of their dogs walking and trotting, which they can cross-compare back to. The only disclaimer I'm going to put in here, guys, is with certain breeds, they're born with problems developing. And just because they've always walked that way doesn't mean it's okay. And this is a really, really common situation in first opinion practice now with certain breeds, especially the brachycephalics. A lot of people are like, but they've always wiggled, they've always shaked and their back feet have come off the ground. They've always had stiff back legs. They've always been front end heavy. You're like, yeah, because they've always had a problem. So let's just quickly go on to about breed variation with Gait. You've got healthy breed variation. As you say, it's within their function. It's what they've been designed to do. And they're comfortable with it, So I've got a collie. Her back legs are much more together. Hock's a bit more inward. She's, very springy. She pivots on her back legs. She's got, strong posture, strong core, flat back. But that's how she's being designed because that's within the breed. And then you've got the German Shepherds that have a sloping back and they're much more strong. But how do owners work out when it's not comfortable within breed and it's actually pathological? That is hard, isn't it?
It's hard, and it probably brings me to the research we're doing right now. So we do have a lot of research, maybe not a lot, because there is some downside to doing research with animals, getting ethics, but we do not know what's normal. And we do not know what's normal to this breed or that breed. And that's why we started off with doing research. And I think we're past 450 puppies in the study. So we have, 4 places where we study the puppies beginning at 8 weeks of age, monitoring them until they're 2 years or even older. And what you said is so important. So different breeds look differently. And, if you had a border collie or a whippet, it looks completely different to a French bulldog because they are designed for different things.
Yeah.
And the other thing is, looking at steepness in their hind legs maybe, or the slope in the German Shepherd. I mean, that's what they're bred for. And that's where you have to pay attention that it does not get to the point where they get really, really bad. I mean, that's what you said. If you have a good core, if you can move your extremities, you know, in a nice way, in a functional way, and you pay attention to it, and you do not see them deteriorate over time, because you know they've always been that way and it's just offloading. Or you could look at Facebook or Instagram and you will see a pug peeing on his front paws and everybody laughs at it, and I'm like, oh my god, this is awful.
I know.
But
And then when they call them peg leg, when they kind of hop and they're very
yeah,
stiff, and go, "Mm." I
but
know.
yeah, it's because we know. But I mean, it's the same with, you know, if you have them trotting or pacing, there are some breeds that will pace. And, you know, if they start it very early or have never really trotted, I don't think it's pathological. But if you see pacing just coming in because they have had an injury, you don't want them to keep pacing. And so
Mm.
there are different things you want to pay attention to, or at least be aware and tell your vet or your physio that has occurred now after they have, you know, ran into another dog or another dog has ran into them. And I mean, we do have some breeds that are awfully bad with their joints. I
Mm.
mean, what you said, the brachycephalic dogs. I mean, this, yeah, that's
It's
uh,
another. It's another story, and I think I will never forget going to an amazing conference. I have to big them up. The Association of Veterinary Anaesthetists. I was taken by the lovely Gwen Covey Crump back in like 2017, 2018. And it was just the coolest conference. But I listened to the amazing Sam Lindley talking about how sad it is that some animals, have developmental disease so early that they live a life of pain because of our, sadly, the breed predispositions, what they've been born with, you know, genetics, mutations, whatever it might be, and they're born with abnormal joints. But because they're young and they're a puppy, people don't ever believe that they could ever be broken. And that gait pattern, that posture, that physical change is accepted as normal. So that leads me on to a really, really important point. I'm still learning a lot, but I do know that you can never make a judgment using one objective modality on its own. So if you were to see something that didn't look right with gait, with posture, with function, then you follow it up with palpation, observation, history. You bring all of that information together, and it may take time. It may take a number of vet visits or physio visits. And then you might even follow up with a modality such as radiography, CT, MRI, and you bring it all together and then make an assumption, because being able, we'd all like to say, oh yeah, I can tell that that's a cruciate from the way it walks. Yeah, I can tell that's lumbosacral from the way it walks. But I personally can't. I can see there's an abnormality, but then I need to go and do further things. Would you agree?
I would totally agree. And I would totally say you have a team of practitioners, including the owner, who are, you know, have to be heard.
Mm.
Because, I mean, you could have a cruciate, but you could also have another disease within the body. You could have spondylosis. They could have, you know, lumbar sacral disease because they've been limping for a long time. So, I mean, being focused as a surgeon is a good thing, because they will work on the region they have to do surgery on, and they are very good at it. So that's great. But, you know, if we work together, and you sometimes they come in and they don't really get better because surgery will only fix one part,
Mm.
and then you have to put together the other parts. And I'm being very honest. I mean, I see my patients maybe twice a week,
Mm.
maybe just once a week. So I need the owner and I need the education. And that's why I think it's so important to have the owner education, as you're doing with Cam. You
Mm.
know, doesn't matter if you take, you know, ball playing, or if you take, you know, using a harness at certain moments, maybe even using different bedding. There's a lot of things that work together. And we as practitioners, depending on which modality you're using, if you're using gait analysis, and I see something within our study, I mean, that's what we said. If we have dogs limping, like really bad, I mean, you could say, yeah, well, it's a study, that's great. That dog's going to develop whatever. So we have a pathological dog within this study. That's not what we're doing. I mean, that's the ethical part of it. So we agreed on, if we have a dog that shows a certain pattern, we cannot, within the study, we can't palpate them and do a whole, workup. But this dog will be sent to the vet, and I will tell them there's something going on. I can't tell because right now we're just using the treadmill. I can see there's an abnormality, but then you have to jump in deeper. And as you said, it takes some time, I mean, it's not just, that's it. It's not a car you can fix like a broken brake or something. So they're different parts that work together. And if we can put dynamics and, all of the components together, I think that's a better picture and it helps the dog.
Yeah,
And
definitely. It's a team approach, and people need to accept that it can take time. And that can be from a dog where people are unsure if there's a pain component. And Sarah Fisher's work, I've heard about free work, where there's a lot of observation skills there, where there's a lot of allowing the dog to move in a low stress environment where you're seeing them turn, climb, sit down, move, and starting to pick up pattern recognition, things that always turns left, struggles to put right fore up, all these sorts of things. So it can take a lot of time. But gait is a really, really big indicator if there's an underlying problem, especially the topic that I love, which is arthritis. So we've kind of covered that there are variations in gait. There's breed variations. It can indicate pathology. It can't be used as a standalone. Now let's kind of move on to, here it was. Knowing what you know now, do you find it hard to see the amount of dogs with utterly, I'm not going to say that word, gaits that are being overlooked?
yes, I can. Unfortunately, I can. I mean, that's something, as you said, you pointed out. I mean, you can see a dog with a cruciate. Yes, I mean, you'll have the medial swelling, you will have a drawer, but you can also say, well, the tarsal joint. I mean, the angle of the tarsal joint might not work for that dog because it's too steep, or they're different things. And sometimes you need to work up muscles and you need to do some prehab before you can do a proper surgery with a good result in it. So working together as a team, or having an approach that sometimes I would like to say to some of the surgeons, well, did you look at the other parts of the dog? Because the knee's obvious, yes, but I cannot take stress of that knee if the other angles do not fit. Or looking at their paws. I mean, if we think about working with horses, the amount of attention a hoof in a horse gets, we do not pay that much attention to the first padding, the first cushioning for the joints that are above the paws. So I think sometimes putting parts together would be easier and on the dog than just taking one part and picking it. So, but to be honest, if you show the owner and if you show the vets that are working on the dog, they're really happy because they get a better understanding what's going on, and this will change some of the surgeries as well, because once you have that in the clinic, and a lot of clinics are really interested in looking at gait and how functional the surgeries are, or how you will look at that angle of that joint and then get a different angle in the surgery, will be changing.
Yeah. I must admit, so we have managed to kind of like do nurse training, vet training, etc. And I say thank you to all the people that trained me. You know, I've learned on the road from many others. None of this is original thought from me. So, you know, thank you to Julie Robertson, Garland Myotherapy, Turid, there's Sarah Fisher, all these people I must recognize. But when we do go on and teach other people, I often have them come back to me and say, my life's terrible now. I just see broken dogs everywhere. You know, I go out to the park and they're stiff. They're not moving well. They've got low neck carriage, low tail carriage. They're, you know, circumducting, swinging out their back legs. They lay down really slowly. And now that I can see it, oh my God, what can I do about it? So gait, really important. But let's kind of now talk about gait development, because this is what a lot of people are going to be tuning into. There's going to be people that work with young dogs. There's going to be dog trainers. There's going to be owners of young dogs thinking, I want to get this right. And this is it's going to be a really interesting topic because, for example, the 5-minute rule, so many people have latched onto it because they want to get it right. They've got their new pup, and they will take information from everybody to make sure that that dog develops well, be it the food, be it the bedding, be it the harness, be it the socialization, the training, and then exercise. So let's now start talking to them about, as an owner or as an influencer of a young dog, why is gait development important? How do we influence it positively? So go from that, if that makes sense.
Yeah, that's probably why we started doing that study, because we do have a lot of opinions and there's not much research. There's not much, facts we can put behind our thoughts. And I sometimes ask myself the question, well, with puppies being an animal that's supposed to move, why do we put in a lot of restrictions in movement? And I don't want them to run around like crazy, but I don't want them to sit on the sofa and wait until their growth plates have closed, because these growth plates are cartilage, and cartilage does not develop on the sofa. Mm-hmm. So this is not soft, or, if you look at the x-ray and there's nothing there. So what we do within the study is we look at the growth plates and we take ultrasound, or we use an ultrasound and look at the growth plates. And we don't know within the breeds when they close, because everything what is out there says it's between probably 6 months and 14 months. Mm-hmm. Who knows? So, and we don't know. That's what we're trying to investigate. But, having the 5-minute rule, and, sometimes it's a cultural thing. So we have like the stairs in Germany where everybody's like, just carry the puppy until you can't carry it, and you have a slip disc
extrusion in your own back.
And I never got the point. So if you have stairs in your house and they're not slippery, you obviously have to make them work for the puppy, unless it's a Chihuahua and they're too large. Yeah. If you have them, they need to be able to master those steps in a good pattern, not running up and down and just jumping up and down like crazy, but everything in a kind of a controlled way, the way you would teach maybe your children how to master stairs. So that's just maybe common sense, because we have so many things that, the internet tells you this, and the other owner on the walk tells you that, and they had somebody tell them this, and then you take a book and there's something else. So there's a lot of opinions out there. So we try to manage to make it, this is a moving animal. So they're supposed to walk. They're supposed to be lean. And we do have a lot of opinions for that. So we have some of the Labrador breeders within the study. So you have the show line, and then you have the working Labradors. They look like completely different breeds. One of them is like a sporting dog, and the other one is just a show dog. But I've been told by breeders that there is no overweight puppy until 16 or 20 weeks in Labradors. And I'm like, what do you mean by there's no overweight in puppies? I mean, if they're chubby and they can't really move around and they have to carry that extra weight, that puts pressure on the growth plates. Isn't the
For
jumping?
anybody that's interested in this area, we did a brilliant live with Alex German, and we've also done one with Alex German and Dr. Ernie Ward. That was cool. And Dr. Alex German has been working on puppy growth charts for many years, and it follows the same concept of the child growth chart, where at different ages you would be achieving different, body mass indexes, etc. And I must admit, I'm from the era where my mum really believed we grew out and up. So me and my brother had phases where we were chubby and then slightly taller and then chubby. And you can actually trace it in the family album. That's not considered normal now from what we know with certainly looking after dogs. So trying to keep them to a good body condition score throughout life is what we're really trying to aim for. And then I also wanted to talk about the evidence-based logic. So when you said common sense, I've changed the way I say this now because it sounds better. And I stole this from Kristen Kirby Shaw. So thank you, Kristen. Evidence-based logic. So when you're going to say common sense, you can just say, well, look, come on, we haven't got the evidence for it yet. We haven't got strong studies, but when we extrapolate and translate and put a little bit of common sense into it. So as you were talking about the slippery floors, but that's kind of common sense, it's evidence-based logic. If they keep repeatedly falling, if they keep slipping out, if they can't place and know where their foot is and it's going to be there as they transfer their body weight onto it, then that is not going to lead to appropriate soft tissue, skeletal and articular development, is it?
No, it's not. I mean that should be understood by people, but sometimes they think it's funny as well, and I get really mad when I've been told that they just run around and then they slip to the side, and it's really funny, and they have their whatever they call it zoomies now, or they just run around like crazy. But it's, if you want a dog and if you want this dog to be healthy, you have to adjust the environment it lives in. And you will not, with stairs, you don't go up and down the stairs like, 10, 20 times. You will make sure that you do a decent amount and controlled way of moving them, and that they're able to do that they can control their body. And like in people, there's some dogs that are really kind of like more like a Pluto, just, all over the place. And the other dogs that are really, the working breeds, like within our study, we do have the Malinois, and then we have like some Labradors, or even some of the Rottweilers that are really all over the place, or a boxer that will be just like, jumping around, and they need to explore their body. They need to know how to move their extremities. They need to know how to move their spine, that they will not, that they can explore their body and that they can keep it healthy. But if you keep going and doing repeated movements just to make it, somehow exhaust them until they're calm at home, that's not going to work. And that's not common sense. That is just waiting for the bomb.
Disaster. So I'm going to put you on the spot because I know that there isn't evidence about this. And I'm putting you on the spot because I want you to agree with me. But you don't have to. Years ago, when I was going to different practices, trying to get the message out that we can do more, I put up a video of a puppy, no more than a few weeks old, and it was trying to stand on a slippery floor, and its legs just kept slipping out. And every time it tried to get up, it slipped out again, and its legs were going here, there, and everywhere. And I had the audacity to say, do you think this dog's going to grow up skeletally, mature? It's going to grow up in the right proportion with the right range of motion and function? Or do you think we're going to have soft tissue injuries and poor development, and then we're going to have poor ranges of motions and offloading and change joint usage, which will lead to early onset arthritis? No evidence to support this. Pretty brave move. What do you think?
Well, I probably have to, go a bit, wider on that one, because I think like in people, you do have some of the sporting people that start off being not as good, but then being trained by a good trainer that pays attention to core stability, to the way they move, to good technique. I think there are huge differences in sporting dogs as well as in family dogs. And if you pay attention, I mean, what I hear now with a lot of the sporting dogs that are supposed to go into agility within our study, they try to keep them off or from moving because of the growth plates, and they might slip if you do too much early. And then they try to keep them from jumping, which I think, jumping, we know in children that they need to jump, that they need to be, this spring tensile system needs to be loaded and unloaded. They don't have to just jump really high levels, but they need to have a little bit of an impact. And I think you cannot tell. We have a book that has been written by some Swiss ladies, which have like a really good, they have a really good observation of those puppies. And they say, well, you can look at a 6-week-old puppy, and then you can tell if it can go into sporting and be like a really good sports dog or not. And I think that's very, very early. And and sometimes might take out some of those individuals that might be really good, but
they might develop.
Yeah, because you just put them to the side because they don't look the way they're supposed to, or the angles are different. And I think if you educate their bodies properly, if you are a good trainer as an owner, and you can have a family dog that is good, has a good body awareness, and you can have a sporting dog that has good body awareness and a good drive still. But I think you have to educate them and make them be aware of their body. And what we had to get back to what you said is that we do have like a glass plate where we put puppies onto it, and you can see some of them slide to the side. And that's where I would say, well, I think you have to pay more attention, and you have to, do different things with this puppy than you would do with another puppy that would just stand there and go like, yeah, look at me. I'm stable.
Yeah, but that is hard, isn't it? Like I'm perpetually reminded that the knowledge that I've accumulated over the last 10 to 20 years isn't within the owners that I'm trying to help. And as you say, everything is ideally treated individually, and you will have some puppies that have got amazing conformation, amazing core stability at a young age, and they can deal with, say, slippery floors, or they can deal with stairs. But you're going to have others that don't. So when you're talking to Joe Blogg's public, how would you best advise them? Because it's a bit like me. I drive my van, and I could drive it with the engine falling out and I wouldn't know. But when it comes to dogs, I can see things that other people can't see. How do we help people do the right thing for the dog? I personally have chosen to be quite strong in my opinions about the environments that we put them in. I think challenge is right. I really do. I agree with you massively. But I think common sense is also quite up there. And I really encourage people to think about the slippery floors that their young dogs are living in and the activities that they're doing them. Chucking a ball in a slippery floor house, I just want to scream, especially when you see the dog sliding into the kitchen cupboard, wallop, and you're like, oh God. So I do have quite strong opinions. Don't get me wrong, I'm sure there are some puppies out there that could chase a ball on a slippery floor. not slip, be able to stop, be able to turn, pivot, place, turn around. But generally, I find it's easier to just have some guidelines. Do you do that as well?
Yes, we absolutely do. I mean, it's not that I wanted to put out the point that, those puppies that are stable, you can just have them, run around like crazy. That's not what I mean. It's just that you have differently talented individuals, that some need more help and the others need a little less help maybe. But then they will need, I think personally, I want the puppies to come in and I want to talk to the owners before anything happens. I want to make them aware that look at your dog, look at their paws. Maybe something's happening down there. Maybe you have to pay attention to this. Why don't you take the dog for a walk and do this or that, not just have it running around with the other puppies? I mean, we basically have some puppies that will be on the sofa, go for 5-minute walks during the week, stay strictly to this plan. And on Saturday, it's puppy play hour.
Puppy marathon.
You have an hour of, puppies chasing around like crazy because they have all that energy. And now is the time. And because we go there and we pay for it, they're supposed to play. There's a lot in between, in the gray scale between black and white. And that's where I think like Cam or, us in the clinic, we have to make them aware of what they're doing. And if they tell you, well, yeah, it's just jumping around or it's slid or it's jumping on and off the sofa all the time. I mean, yes, taking the dog for a 5-minute walk is not the amount of movement a puppy might need. So, you're good on that side, but it might run around the yard because it's chasing, whoever goes up and down the garden, and I've heard that. Or, yeah, we have it on a lead, but it's a retractable lead. So it's on and off like all the time like this. So yeah, it's on a lead, but.
Yeah. So if we were trying to kind of do a little bit of bullet point guidance, so let's cut down to short, sharp piece of advice. What kind of things influence good gait pattern development? And then we'll do bad. So we've already covered weight. Weight is going to encourage poor gait development because restrictive, because of load, etc. What other things in the young adolescent dog would you encourage owners to be observant of?
But I would try to ask them, how does your dog move in certain situations? So where does it, sleep? How does it get up? How long of a walk and where do you walk the dog? Do you walk it like in the woods? Or do you have a certain surrounding, like, you just walk up and down the road because then you're within your 5 minutes, you never ever get to the forest or whatever. So, I mean, there's different things that we want to pay attention to. And we do get asked a lot more now because, I mean, looking at their development and how their body moves, and which we can tell now looking at the evaluation of Gait, is that their center of pressure, how their body moves and how well and how efficient they move, relates to how well they are trained. So, I mean, and it's not just walking. Walking is part of it, but what kind of surface do you offer outside? How well can they balance themselves? Can they, if they're not able to jump up, can they climb up? And doing things slowly and looking at those patterns slowly and trying to improve, not just, I think like a good thing is everybody has wobble boards now. So you see a lot of very nicely shaped whatever. But if you're not able to stand properly on a normal ground and do those exercises like on an even ground, you don't want to go into a wobble board. Yeah.
No.
So
would you suggest like you're kind of describing variety, and we've got that classic English phrase, variety is the spice of life, so different textures, different terrains, within reason, different quantity. So a little bit more, a little bit less difficult, different challenges. Some play, not play, some run, not run, some games, not games, but trying to keep it varied. Would you suggest that that is going to be good for encouraging good gait development?
Well, I'd love to have the results now, but and to be honest, to be evidence-based, I cannot say, well, I think it has to be that way. So,
Yeah.
I mean, I've put myself in the place where I do not want to say, well, I know everything, because I do not know everything. Like every single dog that walks in and every single puppy that walks in is different. But to be honest, diversity is how we develop, and breeding is sometimes, it breaks it down to some standards. And having a little bit more of diversity, I think that helps a lot. And going into transitions, I mean, not just walking the dog, but it needs to know how to trot, because that's a symmetrical gait. And being able to transit from walking to trotting, or maybe even ambling, is okay for that dog. I think that is puts information into the body. I mean, if you think about proprioception only develops and gets better if you train it.
Yes. Explain to people what that means, because a lot of people go, holy what? So what do you mean by proprioception?
So probably make it more understandable as body awareness, and where your limbs stand according to what you stand on, maybe, and the ability, if you walk and then you will, step over something, being able to react to it. So you have your reflexes that work faster. That's the deep muscles, the smaller muscles that will stabilize the joints, that will just be fired on before the large muscle masses will get active. So you have a stable joint, and then you can step over. You will not trip. Something that happens after surgery. I mean, the surgeon has to cut the skin. It has to cut the capsula to get to the joint, and then you will destroy some of the censoring in the body. Being able to monitor, well, how, am I bending my knee down, or am I standing straight, or whatever. And, each of you can just try, if you stand up and try to stand on one foot, you try to stabilize that. There's not much going on. And then you can even challenge yourself and then close your eyes and try to stand there and try to keep yourself stable. And you will always have a little bit of movement. And that's what we see, like if we have a stance analysis, that's where we see where the body is swaying from one side to the other. And that's increasingly happening when they're walking as well. But we don't want, the center of pressure to be all over. We want it to be very efficient. And that's what we can show now when we use the evaluation in clinic, is that with our pattern of making the body more aware of where it's standing and being able to stabilize those joints, we can see that their center of pressure gets more accurate.
Yeah. I think I don't blame owners for not thinking like this, but I think a lot of people believe that there's things that you can't influence, and the development of the nervous system is just going to happen, and the development of the skeletal system is just going to happen, and they're going to be what they're going to be. And I think people need to just kind of check in and go, actually, no, it's really influenced by the outside environment, by the activities, by the loading, by the injuries. So encouraging appropriate, safe, varied movement, fast, slow, play, power, is really, really important to make sure that you get a nice, well-rounded nervous system, etc. Because what happens, and this is going to be what happens if we have bad gait? So I'm going to ask you 3 questions, then we're going to stop because it's already 54 minutes. what can happen with dogs that develop bad gait? So the consequences of a life with bad gait. Then I'm going to ask you five things, knowing what you know now, you would like to advise owners. And then we're going to see if we've got time for 10 dog tips about arthritis management. So yeah, I'm going to squeeze it in. But what is the problem with bad gait? What if someone's going, I don't really care how they move? What can happen?
Well, bad gait, if you don't use your body properly, some of your muscle or the muscle and skeletal system, it will fatigue. And if muscles fatigue, they can't work properly, and then you're more prone to be injured. I mean, that's a lot of times if you look at maybe soccer or any kind of sports, and I've had that myself. I mean, I wasn't prepared for going onto the field. I did it anyway, and I ended up with a cruciate ligament. I knew it. At the point where I was just like, it was plainly stupid, because I knew I'm not functioning properly. My legs were fatigued, and I ended up with a cruciate ligament. Right. And that's sometimes what happens, with dog owners. They know that their dog's not walking properly. I have a feeling, it's not, there's something going on. But, then they want to play with this or that dog, or they need to chase this or that. And then you end up with, some injuries. Some sort of injuries.
And then I'm, as a vet, going to step in here and go, and injuries that aren't attended to can manifest, and the body weight shift away from the area of injury. They'll carry on because dogs are brave souls. They're loyal companions. And over time, that can then just get worse. You've got your primary injury, then you've got your secondary compensations. And that's when we see these dogs that walk in and they have really weird gait patterns and postures and movements. But because the dog doesn't vocalize, because they don't limp, people go, oh, it's just getting old. It's just age-related change. You're like, no, that's just chronicity of injuries. That's one injury to the next, to the next, to the next. And I call them the wonky spider. And you can see that they kind of walk in and nothing's really overtly lame, but nothing's right either. Yeah. And that's really so you kind of like peel the onion, aren't you? Problem here, problem here, problem here. So getting good gait early and throughout life is protective, basically, is what we're saying, isn't it?
Yes. Yes. And
so now on to second question, 5 parts. Knowing what you know now, short snippets of advice for owners. 5 short snippets.
So use a variety of terrains to walk on.
Perfect.
Use a proper amount of movement for that dog, and not just small amounts where you just have them run to make them tired.
Perfect.
Think about weight. Overweight or having too much weight on the bones or on the growth plates is awful.
Yes. And 4, can't bear my finger.
Use a proper, either a harness, and sometimes a collar will work. You have to, just monitor your dog and pay attention to it.
Mm-hmm. And number 5.
Pay attention to nutrition. Nutrition
Ooh.
Is really important, and it's really important for the development of the growing dog.
Yeah, and that's a whole another story. I'll get you back to do that one. And I tell you what, it will explode, because nutrition is also a hugely emotional topic, and there is a lot of thoughts and opinions about that. So we will put that one aside for tonight.
We'll have to shift that to the end of the year, and then we might be able to talk about the questionnaire we have going along with it. So
yeah. Absolutely. I think everybody's got to realize that this is a really exciting and developing area. I think there's a lot of thoughts that are changing quite rapidly at the moment. Daryl Miller's amazing blog about exercising puppies, that went viral, actually really standing up to that concept of 5 minutes for every month of age, and going, where did that come from?
Nobody knows.
Nobody knows. And then the whole concept of trying to rest and restrict, and that came from a hip dysplasia study where they had the belief that if they didn't move, it kept the ball and socket more in place, and so therefore it would develop the better conformation. And people really restricted exercise after that point. So we're learning a lot now. It's great. So just stay tuned. Right, because I've got only 5 seconds, but I'm going to push the limits here. 10 top tips about arthritis. So we're now going to go back to your bread and butter. So we've put gait development aside. You're back to being a rehab specialist. I'll do 10, you do 9, I'll do 8, you do 7. And number 1 is the finale. So you have to think of something good. Okay, so number 10 from me, and I say this all the time, more rugs, less drugs. I really, really see it so often that they've lost proprioception. They have got weakness. They are vulnerable, and putting them in a challenging environment like a slippery floor really isn't going to do you any favors. And I would like to say, and if I ever got PhD funding, good flooring is as good as an anti-inflammatory, because they really do improve if you put good tractional flooring down. Right, number 9.
I think I'll go back to nutrition because I really like to talk about that. And there's so much religion into nutrition, and too much is not good.
Yeah, okay, tell you what. So you've just signed yourself up to do nutrition at the end of the year, and I'm going to let Evie know. Okay, number 8 for me, sleep. And I've learned so much more from Amber Batson. She's one of our advisors. She's utterly wonderful. And it makes so much sense. If you are lacking in sleep, then you are more emotionally and cognitively vulnerable. You will perceive more pain. Life becomes more difficult. Our tissues, our body tissues need time to heal. Dogs are polyphasic sleepers. They need good quotients of sleep. And to do that, they need good bedding. And that beddings need to be surrounded by tractional flooring. So that's number 8. Number 7.
Find practitioners that will listen to you. Depending on vets or physios, they have to listen to you and they have to pay attention. I mean, I know the pattern with the Google, and I Googled it, but we need to listen, to be honest.
Yeah.
Don't stay in your line. And the owners need to tell us and not be afraid of telling.
Yeah, definitely. And I'm just going to big up a few resources that are freely available on our website. There is a resource that says, what has changed for my dog? And it is a crib sheet trying to drain your brain of information that your therapist or vet will need from you. So you can fill it in before the consultation, and you're going there attuned and ready. We've also got the suspicion of chronic pain PDF, where you can start filling in your observations, behavior, posture, physical changes, capability, and gait. You go with that information, you're going to get much more out of your consultation. We are time limited. Everybody nowadays is time limited. So make sure that you're prepared, and there are the resources there for that. Okay, number 6, controversial, ball throwing. Now, I'm talking about dogs that have got full-blown arthritis. I'm not talking about prevention. I'm talking about dogs that have got painful joints. And I think, we really underestimate how much dogs will cope. They'll tolerate discomfort and they'll get on with life. And choosing activities that are pushing their joints and soft tissues and support structures to the absolute limits is not in your interest. So really, really do think about the activities you do with your dog. Even if, and I get this all the time, but he loves it. Does he love it, or is he just so highly aroused he doesn't know what else to do with himself? Right, number 5.
Number 5, think about pain. And pain is not always bad. Pain will also keep you from doing things. So making some decision, if you have a good team around you that listens, they will help you with that.
Expand on that a little bit, just because I think people will go, oh, I'm confused. I think I know where you're coming from with this, but bear in mind that Cam is a real big advocate for early identification of pain and action, because we're talking about arthritic pain that's going to become central sensitized, and it's going to be, you know, a bonfire brewing. What do you mean by that?
Well, it's according to, if you have an arthritic change in the body, you will always have structures that have to compensate for that. And it's not just the joint that we're talking about that is highly arthritic, but you will also have some compensation or maybe acute things that will happen to the dog that you just, you know, kind of like put under a cover. So
Right.
you have to report it back. So we need to know that something has happened, and pain keeps you from re-injuring. But
Yes.
if you, and there's some of the patterns you just, yeah, well, I'm on the painkillers, I'll just, you know, take a double dose or whatever. I've heard things where I'm like,
Yeah. So you're basically trying to say adaptive pain is an absolute essential for life. And we also see adaptive, so we see acute on chronic, definitely in our arthritic patients. And yes, we want to avoid those situations. So we read them, you know, seeing that has created a painful response, we learn from it. That's what acute pain is about. You learn, you heal. I get you. I'm on the same path now. Number 4 is Vet Nurse Awareness Month. Use your vet nurses. These people are highly underutilized, and the whole month in CAM, we're bigging them up and encouraging the public to see value in seeking their knowledge, their skills. Many practices in around the UK have an amazing vet nursing team that will be able to give you more time. They'll be able to approach it more of a multimodal approach because they've got more time. They're more likely to offer you more resources because they've got a little bit more time. They also, secret, they listen more than vets, but don't tell anybody, because they're generally a little bit shyer and they are a lot more likely to listen to your side of the story. Right, number 3.
yeah, I would like to say, well, listen to them. Just according to what you said, they listen to a lot of things that happen in the waiting room, and they will be able to give you some advices that are so highly valuable that, you know, sometimes the vet or a specialist, or even like with us in the physio, so, you know, jogs just walk in there, we're like, yeah, we're going to do this and that. And then you have another hint from them, and that helps. That's amazing. And, you know, sometimes I'm like, why didn't I think about that?
Yeah.
Or they heard something and they will tell you, and you're like, oh, shoot.
That's so true. Being part of a multidisciplinary team will protect you. You know, be open to other people's observations and opinions. I totally agree. Number 2 is my vet hack coming out now. Please don't be in fear of medication. So the truth be told, by the time I see dogs with arthritis present, they are in pain. They are in pain. And you might only see an intermittent lameness, and they put a brave face on and they still wag their tail when they greet you, but they're in pain. And it's our duty of care to get that pain under control as quickly as possible. Now, being prescribed medication might not be for life. You need to speak to your vet, and you need to take the multimodal approach, maybe weight loss, stop throwing the ball, deal with the flaws, go and see a physio, bring other modalities in. Doesn't necessarily mean you're going to be on them for life, but please do not deny pain relief from your pet because you're scared of it or you don't want them to be on it long term. Number 1.
Well, that was a great introduction, because we need painkillers, you know, when we have the dog come in and they are under pain and they're trying to offload. But we also need to gain mobility and, you know, getting those joints to the point where they move more easily, which we can achieve with mobility. But we do sometimes need those painkillers to get on a controlled situation, to get to more mobility and then being able to move. Because with arthritis, we know that some of the arthritis builds around spaces that have not been nourished properly. So if you just go like this and you have the osteophytes, surrounding the joint and making it even stiffer and stiffer and stiffer. And that's just a normal thing. But what we need, together with the vet, have the medication. Don't be afraid of the medication. I mean, there's all sorts of whatever going on, and they're going to have this and they're going to have ulcers and whatever. No, I mean, having pain is a stressor, and it's going to make the dog be worse and worse. Yes, I would just go with that.
No, I agree. And it's really interesting. I say this a lot when I do lectures, is that when I used to do accident and emergency, I could guarantee you if a road traffic accident, if a GDV, if a pancreatitis came in, the owner would say to me, I just don't want them to be in pain. Just do what you need to. I don't want them to be in pain. And that mindset, very logical, get the methadones on board, we get the CRIs on board, we get the dog out of pain. But when it comes to chronic pain, there seems to be this kind of block. And that belief, I don't want them to be in pain, is, well, it can't be that bad because they're still getting on with their life. It can be that bad. So let's all kind of high five the fact that it's our duty of care as owners and professionals. And I know another thing that I see a lot is people will go and seek the support of a rehab team or a complementary therapist to avoid using medications. That's totally understandable, but don't be surprised if they say, I can't do what I need to do until your dog is a bit more comfortable. And then I can step in. My modalities, my exercise plan will unleash the ability to come off of the medications. So
maybe half of the dose or whatever. Sometimes you need a certain amount and they will stay on it. And once they feel comfortable, a lot of them, they just come in and go like, yeah, well,
don't touch me. Yeah, I totally agree. Well, I've stolen 1 hour and 11 minutes of your time. Thank you so much, Georgina, for passing on that blog to the lovely Maureen. I would like everybody that has listened tonight, and you've had like 60 odd people listening. It's a small group to start, but then what happens? More and more watch this, because after COVID, everybody watches on record. But having 60 people come and watch you, lovely. So those 60 people, say thank you to the lovely Kiki for sharing her knowledge. And also write, please come back before Christmas to talk about nutrition.
Well, thanks so much for having me. And I mean, yeah, it's just one of my passionate projects.
Yeah, I'm really lucky because people keep saying to me, how come you're still utterly obsessed? And it's because I meet people like you on a regular basis that just tops the batteries up. So it's a joint effort. It's the multidisciplinary team, but online. Right. Thank you, guys. And we will see you tomorrow, because the amazing Dr. Jennifer Johnson, who was supposed to be on last week, is joining us tomorrow. Poor old Evie, who was her host, was really, really unwell. She lost 4 pounds because of a GI upset. 4 pounds in weight in about 48 hours. So she was ill. She is going to be hosting Dr. Jen Johnson tomorrow. So please do tune in. Until then, see you later.
Bye.